12 early warning signs of lung disease. Lung disease can be a silent threat, often developing slowly with subtle symptoms. Recognizing early warning signs is crucial for timely intervention and better health outcomes. Today, we'll explore 12 early signs that could indicate lung problems, ranging from persistent coughs to unexpected weight loss. By understanding these symptoms, you can take proactive steps to protect your lung health. Early detection can make a significant difference, potentially preventing more severe complications. Pay attention to your body and don't hesitate to seek medical advice if you notice any of these signs. Just a quick reminder, we are not doctors, and this information should not be considered as medical advice. This video is for informational purposes only. Now let's dive into these early warning signs to watch for when it comes to lung disease. Number 1. Persistent cough. A persistent cough that lasts more than a few weeks can be an early warning sign of lung disease. Unlike a typical cough from a cold or flu, this cough doesn't seem to go away. It can be dry or productive, meaning it brings up mucus. This persistent cough might be your body's way of signaling that something is wrong with your lungs. If it disrupts your daily life or sleep, it's even more concerning. While it's easy to dismiss a lingering cough as a minor issue, it's important to take it seriously. If you're dealing with a cough that won't quit, it's time to see a doctor. Early evaluation can lead to better treatment outcomes and give you peace of mind. Number 2. Shortness of breath. Experiencing difficulty breathing during routine activities can be an early indicator of lung disease. This shortness of breath, or dyspnea, might manifest as an unusual struggle to catch your breath, feeling winded, or a tightness in the chest. It often occurs during everyday tasks like walking, climbing stairs, or even talking, making these activities feel disproportionately strenuous. The sensation of not getting enough air can be alarming and may come on suddenly or develop gradually. Unlike breathlessness from physical exertion or being out of shape, this type of shortness of breath happens without a clear reason and tends to worsen over time. Recognizing this symptom is crucial as it highlights potential issues with lung function, signaling that the respiratory system may be compromised. Number 3. Chronic mucus production. Producing mucus or phlegm for over a month can signal an underlying lung condition. Mucus is the body's way of trapping and expelling foreign substances from the airways, but excessive and prolonged production indicates persistent irritation or infection. This mucus can vary in color, appearing clear, yellow, green, or even bloody. Chronic mucus production is often paired with a persistent cough, particularly noticeable in the mornings. The need to frequently clear your airways by coughing can lead to discomfort and difficulty breathing. Continuous mucus production reflects ongoing inflammation or infection within the lungs, suggesting that the respiratory system is under stress. Number 4. Wheezing. A high-pitched whistling sound heard during breathing is known as wheezing. This occurs when the airways are narrowed or inflamed, making it difficult for air to pass through. Commonly linked to conditions such as asthma, chronic obstructive pulmonary disease, COPD, and bronchitis, wheezing can vary in intensity. It is often more noticeable during exhalation and may be accompanied by chest tightness and shortness of breath. Triggers for wheezing include allergens, respiratory infections, physical activity, and exposure to irritants like smoke or pollution. When wheezing becomes chronic or frequent, it indicates that the airways are consistently under stress, reflecting an underlying issue with lung function. Number 5. Chest pain. Unexplained chest pain, especially when breathing or coughing, can be an early warning sign of lung disease. This pain can range from a dull ache to a sharp stabbing sensation, often intensifying with deep breaths, coughing, or laughing. It may be felt in different areas of the chest, including the front, back, or sides. This symptom can indicate issues such as inflammation of the lining of the lungs, pleuritis, infections, or even more serious conditions like pulmonary embolism. Chest pain related to lung disease can be persistent or intermittent, varying in intensity and duration. Before we move on to the next sign, I want to remind you to hit the subscribe and like buttons if you haven't already. Your support is essential in helping us continue to create valuable content for you. Number 6. Coughing up blood. Coughing up blood, even in small amounts, is a significant sign that something may be wrong with your lungs. This symptom, known as hemoptysis, can indicate various conditions, ranging from infections like bronchitis or pneumonia to more serious issues such as tuberculosis or lung cancer. The blood may appear bright red or have a frothy texture mixed with mucus. It often accompanies a persistent cough and can be alarming when first noticed. The presence of blood in your cough highlights potential damage or inflammation in the airways or lungs. Number 7. Chronic fatigue. Feeling constantly tired or fatigued can be an early indication of lung disease. This chronic fatigue happens because your lungs are responsible for supplying oxygen to your body, and if they are not functioning properly, your body may not be getting the oxygen it needs. As a result, you may feel unusually tired even after getting enough rest. Fatigue related to lung disease is often accompanied by other symptoms like shortness of breath and a persistent cough. It can affect your daily activities and overall quality of life, making it difficult to perform routine tasks. Number 8. Frequent respiratory infections. Frequent respiratory infections such as bronchitis or pneumonia can be an early warning sign of lung disease. When the lungs are compromised, their ability to fight off infections is reduced, leading to more frequent or severe illnesses. These infections may cause symptoms like persistent cough, increased mucus production, and fever, which can recur or become chronic. The respiratory system's weakened state allows pathogens to settle more easily, resulting in repeated bouts of illness. Over time, these frequent infections can cause further damage to the lung tissue, exacerbating the underlying condition. Number 9. Swelling in ankles, feet, or legs. Swelling in the ankles, feet, or legs can be an early indicator of lung disease. This condition, known as peripheral edema, occurs when fluid builds up in these areas. It can happen when the lungs are not efficiently moving blood through the heart, leading to fluid accumulation in the lower extremities. This type of swelling can cause discomfort and difficulty in movement, often worsening after periods of prolonged sitting or standing. The skin in the swollen areas may appear stretched and shiny, and pressing on it might leave a temporary dent. Peripheral edema is a sign that the circulatory system is under strain, reflecting potential issues with lung function and its impact on overall cardiovascular health. Number 10. Weight loss and loss of appetite. Unexplained weight loss and loss of appetite can be significant indicators of lung disease. When the body is fighting an illness, it requires more energy, which can lead to unintentional weight loss. Additionally, lung diseases can affect your ability to breathe and your overall energy levels, making it harder to eat and leading to a decreased appetite. This can create a vicious cycle where lack of nutrition further weakens the body. The process of eating itself may become laborious, especially if shortness of breath or coughing makes it uncomfortable. Over time, this can result in noticeable weight loss and muscle wasting. The combination of these symptoms points to a higher metabolic demand placed on the body by chronic lung conditions, reflecting the significant impact on overall health and energy reserves. Number 11. Changes in the color of fingernails. Changes in the color of fingernails, such as a bluish or grayish tint, can be a sign of low oxygen levels in the blood, known as cyanosis. This discoloration occurs when the lungs are not efficiently oxygenating the blood, a common issue in various lung diseases. Fingernails may appear pale or have a noticeable blue hue, indicating that oxygen is not being adequately transported to the tissues. This condition can also be observed in the lips and skin. Cyanosis highlights the severity of compromised lung function and the body's struggle to maintain sufficient oxygen levels. The presence of this symptom can point to underlying issues like chronic obstructive pulmonary disease, COPD, pulmonary hypertension, or other respiratory disorders. Monitoring such changes provides critical insight into the effectiveness of the lungs in oxygenating the blood and overall respiratory health. Number 12. Clubbing of fingers. Clubbing of the fingers is a physical change where the tips of the fingers become enlarged and the nails curve around the fingertips, giving them a bulbous appearance. This condition results from long-term low oxygen levels in the blood, often associated with chronic lung diseases such as bronchiectasis, cystic fibrosis, and lung cancer. The process involves increased blood flow to the fingertips and changes in connective tissue. Clubbing typically develops gradually and can be accompanied by swelling and redness in the fingertips. While it is primarily a sign of lung disease, it can also indicate heart or gastrointestinal issues. Please keep in mind that we are not medical experts, and the information provided here should not be considered as medical advice. This video is purely for informational purposes. If you found this video informative, I invite you to subscribe and check out our other videos on health and wellness.